Hello, and welcome back to LTC Heroes Live by Experience Care. My name is Peter Murphy and Lewis. I'm excited because I'm at day one at HIMMSS 2023 in Chicago, and today I'm speaking to Severence MacLaughlin, founder and CEO of Delorean Artificial Intelligence. Severence, welcome to the program.
Peter, thank you for having me. This is great. HIMMSS 2023. Yeah, this is awesome.
You and I were talking before we got started about your story. Your personal story is interested. Your professional story is interested. Let's start off. Why did you come to HIMMSS? Who are you looking to talk to?
Yeah.
Who do you want to make aware of what you're solving?
Yeah. So HIMMSS, I would have to say HIMMSS is the top healthcare conference in the country, if not the world. And the reason for it is anybody is in town, and I can do more business in this 1 week than like 3 or 4 months. So everybody I need to talk to is here. So who am I looking to talk to? I'm looking to talk to some large insurance companies, large provider and systems groups, as well as we're giving a talk. So, we want those people to come in, and we have a booth. So trying to accelerate our business trajectory, if you would. So.
Tell me about your talk.
Yeah, so we're going to be talking twice this week about how our flagship medical AI can be used at scale to improve patient health, specifically with the largest healthcare payer in the country, or the world, actually.
Tell me about the origins of Delorean, how you got to where you are as a product.
Yeah, I was working in artificial intelligence. I was leading 2 Fortune 500 companies' AI teams, and I wasn't happy, and because we were doing services and we were not developing a product that could be scaled across the country, across long-term care, hospitals, and whatnot. So I left, and I didn't know how unhappy I was until I left, and we started building something, and we started building medical AI, the product. And now, 4 years later, after a whole lot of research and development, blood, sweat, and tears, we have a product that's affecting people's lives in a positive way. So, yeah.
You used some words that I love. You hit my heart as a CNA before we got started. You said you're allowing grandma to give a few more hugs before she passes. Tell me about what your product does to allow her to give some more hugs.
So, no doctor or no healthcare professional, in the whole spectrum of the caregivers, can analyze all of the patients in their facility or within the computer system at a scale. And what ours does is we're able to predict those events in the future, such as a hospitalization, so they can get the treatment beforehand so that a bad event, such as a heart attack or a diabetic issue, doesn't happen. But in the disease state of chronic kidney disease, if we catch it at the right time when they didn't know they had the disease, we can extend their life up to 20 to 25 years. And what's translating that is, what is that to the person, right? It's dollars to a business, but it's hugs to a grandma, right? Or to a grandson, or to a family member.
Tell me about your struggles to get to where you are, and then I'll ask you to kind of tell me what are the major benefits, who your customer looks like today, and what they're getting from your product.
Yeah, this was not an easy road, Peter. So I don't want people to think that this just happened. It was really 10 years of thinking and 4 years of true research and development. We had to go through the scientific process, and your hypothesis is not always proven correct, right? And so we've gotten to the point now that we're at production level, but there's some challenges where people, do they believe you, right? Is AI real? And we are now riding a tide of a lot of big headlines of AI, but 4 years ago we were not. And convincing people to come on board and invest and do that it was challenging. And then getting your first client is really challenging. And we were fortunate early on to get that, and now we're at 14 clients. So.
I'm glad you mentioned the difference between now and 4 years ago, because I hadn't clicked. That hadn't clicked for me. So my follow-up question before we go to the benefits of your product is, what are the aspects of the massification of AI or the commoditization of AI in the last year done to help you, and where has it hurt you? Yeah,
so that's a really good question, especially today. Elon put out a talking points with Tucker Carlson. So, which anyway, at that point, but so Elon's throwing shade at AI right now, and I can't figure out why, because Is it because he hasn't given us any answer why it's dangerous? So he signed that letter along with other scientists, but Professor Nung from Stanford and a couple other ones from OpenAI are saying, no, we need to continue on our acceleration. So I pose the question, what does he know that we don't know? And he's not an AI specialist, brilliant human being, not to take anything away from him. Or is it because he's just started another business for AI and he's throwing a roadblock? I don't know. But AI can be scary, right? People are intentionally scared of things that they don't understand. So what we define AI is something that you can predict something in the future. You can do something about it, enhance it if it's good, or decrease it or mitigate it if it's bad, and then it learns. So our AI is learning probably at a 3-year-old's presence right now, or maybe a golden retriever. But 4 years ago, that wasn't the case. And people didn't even know what AI was. They didn't even know what data science was. So so that was challenging in that trajectory. Right now, it's good because one tide is rising all boats. So if you remember the ChatGPT announcement a couple weeks ago, if your viewership remembers Netscape back in the early 2000s, I believe that's a Netscape event for our industry. But now you're having conversations in the media that by people that don't know what they're talking about, and that's damaging to us.
I told you we were going to go to the benefits, but I want to go back. You keep giving me little crumbs that make me want to keep going down. So you mentioned kind of the 3-year-old lab. Give me in layman's terms for a CNA how you are creating a product that today is at a 3-year-old, maybe next year it's at a 7-year-old.
Yeah.
How does that work from a product development point of view?
So we've done our N is pretty powerful. So we're at 50 million patients nationwide now, and then you can probably imagine the number of records per patient. So we're in the billions of records. So being able to analyze that, so we know mathematically how a patient should behave, and then if they leave that, if you think of a patient as a profile or a sphere, and it has all different degrees, so 360 degrees. So maybe those degrees are different. So we know that they're different, but we don't know how they may behave in a new situation. So take a new drug, or take a new doctor that walks in, or a new nurse that walks into a facility. How does the machine learn how those actions are going to be? So it may not be always right the first time, but when it gets feedback from CNA, from a nurse, from a doctor, and they're entering it into the system, and it knew that, I should have sent it to a nutritionist versus the medication because 7 out of 10 got better. So it makes that decision that, okay, from now on we're going to make the medication versus nutritionist because we got 70% good there.
Where do you tap in to get this information? And maybe you can give me 2 examples. So maybe your first paying customer tapped you into this access of data, and your 14th customer actually tapped you into 4 different areas of data.
Yeah, so we have evolved, Peter. So we've evolved with what data points we ask for, and we know we need certain ones. So now, beforehand it was maybe 30 to 40, now we're up to 50 to 60 data attributes. So for providers, a lot of that comes from the EMR, or prescriptions, or from home health professionals and the notes that they put in. In the payers and the insurance companies, a lot of it comes from claims and other data systems. But as we've progressed, we've asked for different ones. We've also, the outputs are different. So when we first started, it was more care management. And now it's going from the management of either the hospital or the provider group, but also the physician, also the care management, but also the patient. Now, the message will be different, but the patient now, through their portal, the patient portal or email, can own their healthcare and can own that next best action and say, well, I need an appointment with the doctor, or I know there's something wrong with my medication. So that's different and has evolved.
Staying in kind of the development area, and I'm just following my personal curiosity. I have no idea if my audience is interested. How every new client that you bring on, you're having to map over, I'm guessing, their data and give it a specific weight. At what point do you have to quit doing customization, and this can be mass?
So we're past customization. So we're a product now. So to give you an idea, our last client, largest one we've had, was up and operational in 7 days. So the first thing that you have to understand is that we don't bring data over. So when I left my former employer, I wanted to make this decrease barriers as much as possible. So number one was security, because everybody's health information needs to be protected. So we're behind our client's security wall, which is a good thing. Number two is the model evolves. So after all those 14, on the 15th client, it has evolved. And we plunk it into their environment. We run 2 years of their data through it for quality assurance. Is it running the way we're expecting to? And if it is, off to go. But let's say we're going to a new facility. Let's say we're going into a pharmacy, which is not a client like CVS. Well, then we may have to customize a little bit more and then get comfortable with CVS and Walmarts and things of that nature.
Let's go to the benefits. And I'm interested coming from a business development point of view. So your first customer, they came to you and knocked on your door.
They did it, yeah.
For what benefit? And then at 14, the 14th customer, what extra benefits were they already looking for? Because that lapse of time, the market's getting smarter.
Yeah. Well, I mean, we were in stealth as well. So in the last 3 years, we're, a lot of learning. Our first one actually knocked on our door, which we were surprised on. The reason, and they were renal. They were a kidney provider. And the reason for it, which is Medicaid, the government expects to get certain services for the dollars that they get, is that they were 5 times the cost of the national average, about $400,000 per patient. That was huge. They needed help. And so we were able to give them what they were doing wrong, which was causing people to go to the hospital or they couldn't prevent it. And we just knew that there were signals and raw signals. But what we do now is we can actually predict the hospitalization before it happens, and what do you do to prevent it? Now, we're not 100%, we're 85%, which I think is good, just as good as doctor. But preventing those large events that could have catastrophic or death. So,
tell me about the business model that you have today, and what are the answers that are what are the questions still out there, like things that you don't know where you're going to be 6 months from now, or your ideal customer profile, or who you're going to say no to a year from now?
You know what? That's a really So when you're starting a company, Peter, you'll take anything, right? Because you got to put food on the table. And we've been blessed with our clients, so all of them are great. I do think we're going to be much more selective in the future as to who we take on. But what our business model is when I started the company, I wanted as least barriers as possible. The other one is price. So I already invested my own money, my own house into building this product. So the cost is not as what they would be for a consulting firm. So what we do is we charge AI as a service. So your readership or viewership may have heard of software as a service. So we're similar. So you only pay for what you use, and then those results come out. Now, in the future, we want to concentrate not only on health systems and payers, but we're now looking to get in, like I said earlier, about the pharmacy benefit schemes. So making people have the right medications at the right time. But do I really want to get into bed with pharma, right? Because it's another side of the coin, and you have to a whole lot more customization, which you brought up earlier. So that's our decision point, and hopefully in the future.
What do you want to learn here? Maybe completely unrelated to your work. What, from a technology point of view, from healthcare point of view, from what's happening?
So our products are currently renal or kidney, cardiovascular, and diabetes. And we've been asked by a number of clients to look into mental health. So I'm here to learn about mental health and COPD, because those are our next 2 products. And again, not in my area of expertise, but I want to go to as many talks as possible to hear about this and then see what we can bring back, and then also meet those leaders so I can bring their knowledge to here.
Great. Severance, as we start to wrap up, tell me where your booth is, if you remember it. If not, we'll call in your PR person. And if we stop by, what kind of questions should we be asking you that we haven't heard here on today's interview?
Yeah. So first of all, please swing by the booth. What booth number? Our booth.
You can call her out. I put you on mute.
What's her booth number?
Well, that was tough.
Yeah, 600969.
Just come on over.
Yeah. So come by the booth, meet Jen. Jen's over here, and Jacob, and ask for a demo, right? Because some people don't believe this is real, right? And once they see the demo, they're like, "Whoa!" Right? Like, this blows their minds. The hair goes back, and be part of the journey, right?
Wonderful. Pleasure meeting you.
Peter,
thank you so much.
Really appreciate the time.